Pulmonary fibrosis. Pulmonary fibrosis is an interstitial lung disease that is characterized by damage or scarring of the alveolar epithelium. This scarring creates thick, stiff tissue on the lungs, which make lung expansion and gas exchange difficult. Pulmonary fibrosis can be obtained through a variety of ways, although it is most common idiopathic. Injuries to lungs can happen through different occupations, environments, or drugs. Examples of these include smoking, asbestos, or even animal droppings. Additionally, scar tissue from disease recovery such as TB or systemic sclerosis can cause it. Lastly, chest irradiation can lead to scarring of the lung tissue not seen for months or even years. Pulmonary fibrosis can affect the life in many different ways. If we look at it from an IFC standpoint, one example would be body structure and function would be lacking gas diffusion. So the activity that would be affected would be walking. And at the participation level, you can see that you'd have decreased community ambulation. Pulmonary fibrosis generally impacts people 50 years of age and older. Most epidemiology numbers are vague estimates, but according to the University of Michigan, there are around 100,000 cases in the US. There is no single standard drug for pulmonary fibrosis. Exacerbations can be treated with steroids such as prednisone or antibiotics. Immunosuppressants and antifibrotic agents are other approaches when used. In 2014, Vainschelboim et al. Did a study to see if exercise impacted different areas of people with pulmonary fibrosis' life. And so it was a randomized control study where 15 participants had a 12-week bi-weekly hour-long exercise training session, and they also took the meds required for pulmonary fibrosis. Then there were 17 that continued treatments with just the meds alone. At the end of the 12 weeks, it was shown that the exercise training group improved exercise tolerance, functional capacity, pulmonary function, dyspnea, and quality of life. So as this relates to the PT, your ability to push pulmonary fibrosis patients to exercise can increase many facets of their life. And if you see an IPF patient on meds alone, make sure you push for that exercise along with the meds. Melinda et al. Published a study in 2015 that looked at cognitive function and different levels of pulmonary fibrosis. And so there was a group of 12 patients with severe pulmonary fibrosis, 34 with mild to moderate, and 15 for a control group. All three groups were put through 5 different tests. So some of these included the Hopkins Verbal Learning Test, Groove Pegboard Test, and the Stroop 3 test. When the tests were all said and done and controlled for gender and age, it was shown that there was inferior performance on tasks requiring speed-divided attention, such as the trail-making test, and there were slower processing speeds when requiring suppression of a familiar response, which was the Stroop 3 test. So this all goes to show that severe idiopathic pulmonary fibrosis patients will have potentially worse cognitive function than other patients you may deal with. So as a PT, when exercising these patients, keep the tasks and exercises within their abilities physically and cognitively, and also ensure that the task is completely understood before taking action to ensure maximum safety for your patient. As far as Schulte's top 20, it applies to 3, 6, and 7 very obviously, and then it applies to probably every other single one too, but it is a restrictive lung disease. Ventilation and diffusion are both reduced, and the oxygen hemoglobin dissociation curve is likely to shift to the right.